All right. Hi, everyone, and welcome to our session today. My name is Rob Miyashiro, and I'll be your moderator for today's session. I'm the Executive Director of Lethbridge Senior Citizens Organization. I'm Chair of Age Friendly Lethbridge and a member of the Alberta Age Friendly Community of Practice. So it's really my pleasure to welcome you to our first session in our Diverse Seniors webinar series. Something's wrong with my computer. Hang on a second. In our Diverse Seniors webinar series. And this one is about setting the stage. So to begin, in the spirit of our journey to promote reconciliation, let's honor the truth of the shared history and acknowledge the many First Nations, Métis, and Inuit who have lived in and cared for these lands for generations. We're grateful for the traditional knowledge keepers and elders who are still with us today and those who have gone before us. I'll now walk us through some housekeeping items. So, sorry, guys, we're using a new system today, and I'm just kind of getting lost a little bit. So make sure you're comfortable for the next 90 minutes. You make sure your mute button's on, and you can have your camera on or off. Doesn't matter what you're comfortable with. Keep yourself on mute while the presentation is being made, please. You can see the participants list by clicking on the icon at the bottom of your screen. You'll also see the option to raise your virtual hand. And later on, we'll be inviting people to click on that when they want to help us manage a conversation or have a chat. So now we also encourage everyone to use the chat box to share your ideas, thoughts, or to ask questions. And we have Carol as our chat box moderator today, and she'll help relay your messages either to myself or Danielle. And we can see people have been sharing their name, location, organizations already. And if you've just joined us, welcome you as well. And please share who you are in the chat box. This presentation is recorded and will be shared on Core Alberta. If you'd like to turn off your cameras or adjust your screen name, you may do so. And then because it's already been recording, then your identity will be protected. So this series is being hosted by the Alberta Age Friendly Community of Practice. This community of practice is designed to help communities that are considering or in the process of developing an age-friendly plan. In this closed group, our members meet regularly and offer support to each other in a mentoring capacity. There's also an open discussion group that's open to anyone interested in the age-friendly concept or its 8 domains. The focus of this group is disseminating information and providing opportunities to ask questions and share information. Members may or may not be involved in an age-friendly initiative. If you're interested in learning more about age-friendly and these two groups, I encourage you to visit corealberta.ca, which most of you probably are already. So what is age-friendly? Age-friendly is a model to enable active, healthy aging by focusing on 8 domains of community living. Age-friendly communities help seniors remain engaged in their communities through the development of supportive, built, and social environments that facilitate exercise, social connection, and respect for seniors. The journey to become age-friendly employs a bottom-up participatory approach that involves the active participation of citizens of varying ages and abilities in all aspects of planning. The cornerstone of the age-friendly model is the development of a community plan, which brings together traditional and non-traditional partners to identify community assets and strengths that facilitate social inclusion of seniors and factors that hinder it. When embarking on age-friendly community development, visit the Stats Canada demographic profile for your community to understand the specific ethno-cultural composition of your area. Each age-friendly plan is unique as it addresses that community's specific needs, recognizes the diversity of its population, and promotes initiatives to reach as many people as possible. Implementation can be achieved through small steps initiated by local community members through more major initiatives that require greater resources and contribution from a broad group of people, or the collaborative efforts of a range of groups. In practical terms, age-friendly environments are free from physical and social barriers and supported by policies, systems, services, and products and technologies that promote health and build and maintain physical and mental capacity across the life course and enable people, even when experiencing capacity loss, to continue to do the things they value. Age-friendly practices help build older people's abilities to meet their basic needs, to learn and grow and make decisions, to be mobile, build and maintain relationships, and contribute. In doing so, age-friendly practices recognize the wide range of capacities and resources among older people, anticipate and respond flexibly to age-related needs and preferences, respect older people's decisions and lifestyle choices, reduce inequities, protect those who are most vulnerable, and promote older people's inclusion in and contribution to all areas of community life. Seniors are a diverse group, including different cultural and ethnic backgrounds, sexual orientation, and those with disabilities. Furthermore, older Albertans span more than two generations. We have a wide spectrum of skills, abilities, support systems, living arrangement, levels of education, health, and wealth, all influenced by their unique experiences, lifestyles, and circumstances. This series will explore how senior serving organizations, aid-friendly partners, businesses, and others can help foster a shared understanding of the needs of diverse populations of seniors and identify enablers to the inclusion. Through these sessions, the Alberta Age-Friendly Community of Practice aims to encourage and facilitate a variety of local initiatives that support a sense of belonging for diverse populations of seniors. This opening sessions will delve into the fundamental principles of equity, diversity, and inclusion, and explore how to transform the way we support diverse and senior populations. You will be introduced to key concepts and insights for embedding EDI frameworks into organizations and communities. And together, we will examine actionable strategies and practices that foster a true sense of belonging for all seniors, paving the way for the following sessions in the Diverse Seniors series. I'd like to now, and I'm really pleased to introduce to you our presenter today, Danielle Fraser. With a strong background in community engagement, project management, and service design, Danielle applies an equity lens to all areas of her work. She's a consultant with a breadth of knowledge in equity, diversity, and inclusion, applied in both policy and practice. She offers experience designing high-impact projects, events, and programs on behalf of nonprofit and public sector agencies. Danielle combines her educational background, passion, and lived experiences to help organizations align their who, what, why, and how with equity, diversity, and inclusion principles. And last but not least, she's a wife, mom, and a proud introvert. So everyone, please welcome Danielle.
Thank you, Rob. Good morning and welcome everyone. I feel so grateful and excited to be here today. My name is Danielle. I am the founder and principal consultant of More Than Enough Consulting. And as the title speaks for itself, I'll be setting the stage for today. So I usually start when speaking about equity, diversity, and inclusion. I always start by asking, typically in person, the audience two questions. For today, what I'll ask is if you folks can just answer them in the chat. So the first question is, how many of you have heard of equity, diversity, inclusion, accessibility, and / or justice? So either together or apart. How many of you have heard of these principles? Awesome. I'll give it a few seconds here. Let me just open up the chat. Awesome. Okay. Yep, and belonging. Yep. Perfect. Okay, I'm gonna give a few more seconds. Anyone else? Okay. The second question, how many of you, and I invite vulnerability here, how many of you feel confident that you have the skills and the tools to integrate equity, diversity, inclusion, accessibility, justice, and / or belonging into your work, into your communities, into your programs, into your services? Mm-hmm. Love that. Confident, but always learning. Mm-hmm. Mm-hmm. Awesome. So thank you so much for answering those questions. Um, I asked this mainly for, I guess, research and evaluation purpose, but also teaching. So, and I'll speak more to this in a few moments. But this is where I see leaders, community developers, coordinators in general, sorry, organizations in general get stuck. We know that equity is important for us to prioritize, but it's the how where I see folks often struggle. Next slide, please, Carol. So, and that's what I'm hoping to do in setting the stage for the Diverse Seniors webinar series. The series will have sessions on immigrant and refugee seniors, LGBTQS plus seniors, Indigenous seniors, seniors living with disabilities. These are all really great sessions, and you will get so many learnings from them. But how can we take those learnings from those sessions and integrate them into our work? So we'll dive into the core principles of equity, diversity, and inclusion and explore again how to apply them to be able to enhance the impact of your work. So the agenda for today, we'll start by breaking down what is EDI. Step number one, right? Then we'll go into equity frameworks, and this will be our how. Then we'll go into understanding diverse human needs, and then throughout, we'll have some takeaway tools, and then I'll finish up with some next steps. Next page, please. So I always like to begin my engagements rooted in connection, and that means rooted in connection to me. How do I show up besides the person speaking to you today? So first and foremost, as Rob mentioned, I'm a wife and mom, specifically a mom to a 2-year-old who's almost 3, and I want to just say that we're seeing the end of the tunnel of the terrible 2, so we got to give a little clap for that. I'm also a Torontonian. I moved from Toronto to Calgary in 2021 with just 3 of us, my little family. My favorite form of movement is Pilates and weight training. I love lifting heavy. I like to tell people that I'm a wine connoisseur, but not really, because I really just like wine. My educational background is in political science, social justice, and community engagement. And last but not least, I'm an equity design consultant that helps organizations build equity into their who, what, why, and how. And so I combine equity design, systems change, systems and policy approaches to help organizations align their operations, their strategy, their governance, their culture, their marketing and communications, etc. Next slide, please. And so also just a little housekeeping. If you have any questions throughout, please ask them. I will stop and answer them because I find it helps with more of a conversational session. So feel free to ask questions as we go. So what does that even mean? All the things that I just said about helping organizations build equity into their who, what, and how. So I will start by defining equity. I find in the past I've explained equity as a principle, but I find that it lands better for folks when I describe it as an outcome. An outcome where a person's access is not determined by their background, their identity, or their abilities, right? So our success and our failure is often determined by our ability to access places and spaces. Let's say higher education, for example. And the key to be able to access these spaces, without our identities being a barrier. So our age, our race, our religion, our socioeconomic status, where we live, our abilities, right? And how we achieve equity is going to be through collaboration and co-creation. So in order to establish an outcome of equity, the definition of success, the definition of failure, barriers, solutions must be determined from the community or the partner that you're aiming to serve or support. So depending on how you're approaching equity work or what the need for equity work is you might want to collaborate and partner with the communities that you're actually serving. You may want to build equity into your people and culture, so that will require you to collaborate with your staff. You may want to build equity into your volunteer programs, so that will require collaboration with your volunteers, and you can fill it in from there. Next slide, please. So when we have diverse voices at the table, in the room, able to access the space, a part of those conversations, or the outcome of those conversations, we will get to learn. We'll be able to grow. We'll be able to form understanding. We will be able to form connections. We'll be able to identify barriers, systemic gaps, and that is where the magic happens, when we have a diverse presence of individuals at the table, in the room, able to access the space. Next slide, please. And so when we problem solve, when we have these conversations, when we collaborate alongside each other, we often improve accessibility and build those inclusive places and spaces. So when we look at EDI as a set of outcomes, right? For example, we want to work toward and sustain equitable programming. We want to work toward and sustain inclusive programming. We want to work toward and sustain diverse programming. This is where you could start to see, and this is also where you can add in those additional principles, right? Of belonging, of accessibility, of justice, because ultimately we want, again, referring to programs, we want our programs to be diverse, equitable, inclusive, fair. We want our programming to create a sense of belonging, right? All an outcome. And again, you'll be able to see how all of these principles, all of these outcomes are interrelated and rely on each other to become realized. However, when we view EDI as a set of principles and outcomes, we are placed in an area of opportunity where we can start to explore the how. So that was step number one. Next slide, please. So again, EDI conversations are typically around what it should be. Therefore, of course, we struggle with our how. So if we go back to our initial question of how many people have heard of EDI, right? The typical frame of the conversation. In these spaces, I ask people to raise their hand, and I usually see between 70 to 80%, depending on where we are. We usually see between 70 to 80% of hands raised. That's majority of the room. But then when I ask that second layer of the question, how many people feel like they have the skills, the tools, or even maybe even the resources to be able to apply those principles? And we might see about 20 to 30 people. That is where the discrepancy is, right? So when, for example, we might see organizations begin their equity journey with a workshop, because that is oftentimes, that is oftentimes our first stop in our how. If we do the workshop on unconscious bias, for example, we now know that leading with bias and stereotypes is wrong, and it's something that maybe we shouldn't do. But what does that mean in terms of organizational and cultural change? Not much, because that workshop lived within the people that were in that workshop. That workshop lived within the people who now have the choice to be able to say, or to be able to choose whether or not they want to exercise unconscious bias or unpack their biases and do that work of change. So in order to have the impact and the transformation that we're looking for when it comes to equity, we must take a systems equity design approach. So to bring EDI into practice, we do this using equity frameworks. And some of these frameworks might look familiar to you. In fact, some of these frameworks are going to be a part of the series. And these, again, are just some frameworks. There are so many frameworks that I use to support my clients in this work. So some of you, so again, frameworks are a compilation of experiences, tools. Some of them include step-by-step guides sometimes that help understand, implement, and work towards designing equitable, diverse, and inclusive places and spaces. Next slide, please. So how do we do it? What do these frameworks even do? They center lived experience. And that is going back to our definition of equity. When we center voices using a design approach, we do two things. And let's use our anti-racism framework as an example. First, it allows us to identify gaps. It helps us acknowledge and understand the historical and systemic context of which racism exists, without putting that burden and labor on racialized people to do that work for you. It often reveals, if not all the time, reveals how we then show up in anti-racism. So for me, how I show up as a racialized person within anti-racism is going to be different to how a non-racialized person approaches anti-racism. And so it helps us contextualize how we show up in that work. It also allows us to understand the impact and how experiences are shaped by racism, for example. And the second thing that it will do is it helps us move forward. It helps us in implementing those best practices. It helps us with the how. So again, that work is usually started within ourselves. And the frameworks will guide us in that work, in addition to helping us bring anti-racism frameworks to our organizations, to our culture, to our people and culture, to our programs, to our services, again, to our entire operations of our organizations, our organizational groups, our networks. And next slide, please, Carol. And so this is another equity framework or approach that I absolutely love. I apologize for it's supposed to curve into the onion. I guess when I downloaded it, it kind of messed up there a little bit. But this is the organizational onion. I learned of this tool through a local organization here in Calgary called CommunityWise. And what it essentially does is it encourages us to look at our organizations or our groups or our networks as an onion that can be like similar to an onion. You can peel back the layers, right? Within our organizations, we can peel back the layers to reveal different, again, layers of the organization. So we have here our programs and services. We have our human resources, we have governance, we have strategy, we have policy. And when we peel back all of the layers, we get to our mission, our vision, and our values. So again, if we think about EDI as an outcome, we can take our learnings from our frameworks and we can use that approach to create and design equity at the forefront of everything. And so using a systems design approach is the only way we can ensure that equity isn't a one-time thing that we did, that we're trying to do, that's oftentimes on the side of someone's desk, but actually how we do things. And this is how we achieve sustainability and transformation. So in order to prioritize and commit to this work, going back to, it's called CommunityWise, they did some really great anti-racism work and published some resources. So yes, please check them out. And again, in order to prioritize and commit to this work, we must attach our mission, vision, and values with equity. And so the organizational onion is a really helpful tool in guiding us to do that. So the organizational onion is perfect for the organization or the group, the network that has never done any equity before. Because again, we can audit each layer of the onion, but we start at our mission, vision, and values. At this point, but how do we do that? Next slide, please.
Yeah, I think it can be argued either way.
I help organizations align their mission, vision, and values, or their why, their how, with equity through a tool I developed called the alignment statement. And this helps us do a few things. First, it helps us to create shared language and clarity, right? This helps us to it ultimately helps us to support the people who are doing the work, the people who are advocating for the work. And two, it helps with buy-in. And if we're being totally honest, buy-in is such a reality of doing this work. We can't do this work by ourselves. So we need collective effort. And so to help in that process of buy-in, of creating shared language, of creating clarity, we call this the alignment statement. Next slide. Before I go into this, I want to share an impact story. So for context, I'm actually currently doing this work with Healthy Aging Alberta right now. So last week, I had a Healthy Aging Alberta staff member end a meeting with gratitude, sharing that he had used his alignment statement in conversation with community. Essentially, what allows is when we get certain questions, right, certain relevant, important questions of why we're doing this work, these alignment statements almost roll off the tongue with such confidence. And the key is when you attach something to an organization, mission, vision, its purpose, it's hard to separate the two, right? In order to do one thing, you have to do the other. And so we get questions like, why is equity, diversity, and inclusion important? These are valid questions that are filled with so much curiosity, discovery, and opportunity, I like to think. So, for example, and this is my favorite example because kids are a soft spot. So this is an example of an alignment statement in practice, which again aligns the organization's mission, vision, and values with EDI. So if an organization's mission is to provide school lunches to all kids living in Alberta, this is a huge calling requiring an equity approach. We can't achieve this mission without it. So their statement could look a little something like this. Okay. Why is equity, diversity important? Well, in order to achieve our mission to feed all kids, we have to acknowledge that kids across the province have different experiences, barriers, and dietary needs based on their faith or allergies or health needs, for example, which then requires us to commit to constant learning, exploring, and collaboration, not only with the kids that we are serving, but also with who these children belong to. Where are these children usually when they're eating lunch? At school. That requires collaboration with schools. So when we start here, we set the stage for our how, right? Any questions so far? Okay, we can go to our next slide. So the main point that I want to make is that in order to work towards equity as an outcome, we must center the voices of those with lived experiences. You must work in collaboration with the communities that you support, right? You cannot have one without the other. We cannot achieve our mission. We cannot realize our vision without the voices of your partners and the communities that you serve. And so to understand the barriers is to also understand the needs. And so what we see, or the harm and accessibility, basically the opposite of EDI, right, comes from the assumption. It comes from the idea or the implementation, right, of this one-size-fits-all approach. Assuming that this one way to do things is how everyone else does things. Assuming that this one way how we do things, assuming that it's accessible for everyone. But that is not the reality. Next slide, please. So I had the privilege, again, of working alongside Healthy Aging Alberta over the last few months, actually more than the last few months. I would say since about March, right? To design and co-facilitate the engagement of over 247 senior serving organizations / groups, and 126 older adults themselves. This is huge, by the way, because that tells us that we had hundreds of people, both serving and older adults themselves, now able to inform Healthy Aging Alberta's work, their how, their who, their what. And so we were able to successfully engage with the community, again, shifting power to older adults to be able to define their values in a healthy aging experience. And in this work, we connected with Black, Indigenous, serving organizations in rural areas, older adults that lived in rural areas. We connected with faith-based groups. And I'm missing some, but that's what I have on top of my head right now. And so although we're still in the thick of this work, the intention is to take those definitions and be able to build them, again, into the who, what, why, and how of Healthy Aging Alberta. And so through our engagements, here are some of the things that we learned, or that we heard. And I want to share them with you, not because they are relevant to your work with seniors, but to illustrate a process and also its importance. So in order to understand and address the barriers that, for example, equity frameworks might reveal, we also want to understand the needs and the values of communities determined by that community. So, for example, we heard that underrepresentation is a barrier to access to space. So if someone wants to access a recreational space, but doesn't see themselves in the staff or in the people within that space, oftentimes that sends a message. And that message will land as this space is not for me. So that indicates that representation is a need. Discrimination was another barrier, while connection was a huge need to a healthy aging experience. So while connection is the barrier, connection is the need. Another one, for example, is respect and independence. This was a huge need and value that was shared. But leading with bias and assumption and cutting out seniors out of decision-making around programming, development, and services is a direct barrier to the need of feeling respected, included, independent. Next slide, please. So, I want to bring this full circle. In order to build equity into our organizations, our services, our programs, our marketing, our communications, we must center the voices of the community that we support. This is equity in practice. So the 3 action steps that I want to give to you, leave for you, is step number 1 is an audit. We first want to be able to identify who are the communities that we serve. And here is where we want to, here is where we can start to unpack that one-size-fits-all approach, right? We serve all people of all races, of all backgrounds. That is a one-size-fits-all approach, because it ignores the realities of the different diverse groups. It ignores the barriers of different diverse groups. So it's necessary to be able to define the communities in which you currently support, whether that's immigrants. Awesome. Where are those immigrants from? Where are they? Where do you see the immigrants that you serve? Where are they typically from? Cool. Awesome. You also serve racialized folks. What race? You serve folks of all abilities. Awesome. What abilities? And again, I can go on and on and on. And so in doing this work, it will also reveal who is underrepresented, which will lead us to start then asking why. And this is helpful for organizations who want to start engaging with different diverse groups, because an engagement strategy for Indigenous folks will look different from an engagement strategy for faith-based folks, or an engagement strategy for folks who live in rural areas. So again, you want to be able to understand and know who you're connecting with, who you're talking to, so that, step number 2, you can identify the equity framework. Again, not fully relying on the communities that we identified to do most of that teaching around historical and around historical context. This is where you want to leverage, and this is exactly where you want to leverage this series. So let's say, for example, you know that you serve, that your organization, your group works with or serves a high immigrant population. Your first step would be to identify the specific immigrant populations, and to be able to use the following immigrant series to be able to start do that learning, to be able to offer context, to be able to do that understanding, and maybe even start to form those connections. Then with 3, I would encourage you to engage meaningfully in solution-based co-design practices. How you engage is based on, again, the specific group, the specific individual, the specific community, and begin to focus on building trusting, mutually beneficial relationships. And I really want to emphasize here, solution-based. Next slide, please. Actually, we can go back, sorry. One more note. And so and the reason why I have this in a cycle, illustrated as a cycle, is because I acknowledge that this is a lot. This is a lot, what I shared. And so that's why it's important that it's a reoccurring process. Ultimately, we're humans that work with humans, and we evolve, right? We evolve, we change. And so it's important that we continue this relationship. It's important that we continue doing the audits. It's important that we continue learning and understanding. It's all a part of the process. And then last but not least, we engage with that meaningfully. So, next slide. Yeah, there we go. So what does that mean? What that might mean for you and your work going forward? You might be asking yourself, okay, I'm still stuck on the how. Reach out, please. If you're still wondering what collaboration might look like for you and for your group, your communities, your staff, your volunteers, please reach out. If you're wondering more about frameworks and what frameworks are relevant for you or your organization or your group, reach out. Again, if you have specific programs or services or initiatives that you'd like to see how you can build and reveal the layers of the onion, again, don't hesitate to reach out. And if you just want to say hi, reach out. The barcode here is my LinkedIn. So again, you can reach out via LinkedIn or email. And that is all for me today. I really wanted to offer space for questions and some answers. So I guess we can go into that.
All right. Thanks, Danielle. So one thing, we noticed that a bunch of you logged in partway through the presentation, and we noticed there was a glitch in the invitation that went out. Some of you came in early, some of you came in later. So just remember that this is being recorded and will be available probably next week on Healthy Aging Core Alberta. So thank you for your patience with that issue. So if you have a question, you can type it in the chat, which I think a couple of you have already, or you can click the hand at the bottom of the screen, and then go from there. So, Carol, what's your first question?
Hi, Danielle. Somebody wanted to know the source of the onion, the slide that you had, and where you got that information from.
Yeah, that is from an organization based in Calgary called Community Wise. And they led some amazing anti-racism work, some focusing on organizational change. So that is where I got that organizational onion and has been really integral to my design process.
Nice. Quiet group.
Hi, Danielle. This is Rochelle. I have a quick question. If unless I don't want to interrupt anyone else that might have been going, it's okay. So I guess maybe just like some initial thoughts. I work with Calgary West Central Primary Care Network, and I'm currently embarking on a project to do an evaluation of our seniors assessment clinic. So this is an assessment clinic where family physicians can refer for additional consulting around so complex health needs of a senior patient of theirs. So frequently it's around like driving, dementia, poor mobility, like things like that. So, but since its inception over 10 years, we have never really evaluated the program. And so part of the evaluation of the program is we want to do engagement with patients and families who've interacted with the program. I think where the challenge is in interacting with people and maybe getting feedback or applying feedback is that we're not like an ongoing program. We're not like a family physician medical home where people are going to continually coming for care. We're not like a seniors club where people are joining programs and joining in. So in order to do you have any, I guess, initial thoughts around doing meaningful engagement around, like you had mentioned, like solution-based co-design, when the interactions that we have with patients are maybe only a few visits, maybe some follow-up is 6 months later, but may only have limited connection with them through this evaluation process.
Yeah. So here I can speak to Healthy Aging Alberta's approach and like our approach working together, because Healthy Aging Alberta's most of the work, it's a network, right, that is designed for senior serving organizations and not older adults themselves. So to connect with and to do that work of engaging with older adults, it took some collaboration in figuring out and discovery in figuring out, okay, how do we do that? So that looks like working with, collaborating with some of the leaders within the network to help us connect with and access their communities of older adults, if you know what I mean. So sometimes it takes discovery and creativity to figure out, okay, no, sometimes if your programming or the services, how it's set up, is not necessarily focused on or allows for that space of relationship building and connection, then I would suggest looking at how we can discover and create maybe a separate area for that. So that looked like for us working with different leaders to connect us with different older adults and doing focus groups, or I like to call them community conversations.
Okay, yeah.
Or that doesn't have to be groups. That could be inviting folks to have one-on-one conversations, inviting folks into that space. However, I do want to caution that there are steps that you take to ensure, there are intentional steps that you take before that. But again, leaning in with curiosity. And if you have, again, if you're really curious about designing what that could look like in terms of collaboration, please reach out.
Yeah, I will. Thank you.
Great. Carol, another chat question?
All right. First, just want to say that there's a comment here from Cheryl, And it's just want to make a comment that this was a great session and very informative. So thank you, Danielle. Someone also asked for your contact information. So I have put that in the chat from your slide, the email and the phone number. And then Galen would like to know, could you please discuss alignment statements further and maybe another example, please?
Oh, this is my favorite. I love alignment statements because they work in so many different areas. I will sing them from the top of a mountain. So are you specifically looking for how they can be used or how they're developed, or should I go through everything? Maybe. Oh, I have them coming here.
Go through everything, please.
Noted. Okay.
Yeah,
So,
do you want to throw that slide back up there so people can see it again about alignment statements?
We'll throw it back up. So, okay, I'll walk through another example. So I am working with an organization that is looking to explore how we can build equity into their volunteer programming. So we did all the background work of coming up with the plan to do that engagement. We decided that sending out this organization, by the way, has a great relationship with their volunteers. So we didn't have to do a lot of that relationship building work because that relationship already existed. So we decided to send out surveys. And so the volunteer manager asked me, okay, what do? We want to have a plan for when there might be that person that reaches out and says, why are we asking these questions? These questions aren't relevant to me. I don't necessarily see the value in diversity, equity, inclusion. Why are you guys doing this? That's where the alignment statement comes in. So that would look like, can we go to the other slide where it has everything drawn out? So that would look like responding. And again, we use these statements in so many different areas of our work, not only just to align our mission, vision, and values specifically, but to connect our mission with different equity initiatives or the different equity related things in practice to achieving our mission. So for example, that response to that specific volunteer who would say, well, in order to improve, in order to meet the needs of our volunteers, which actually helps us to meet our mission of whatever that mission is, we have to acknowledge that our volunteers are diverse and that they do require different things to be able to show up to volunteer. They all have different interests. They all have different needs, which requires us to collaborate, to ask, to lean in with curiosity, right? So again, it's that process of shared language, clarity within our teams, but then also within our external partners. How does that for another example? Did you need another one? This is also, the alignment statement is also helpful for, I work with a lot of frontline team members or team members that are working in community and are directly seeing the impact of inaccessible one-size-fits-all programming or services. And so typically with leadership, how power differentials work, right? Leadership can be removed from that impact of a lack of equity, diversity, inclusion. And so when I work with people who are on the front line or working in community, I'll help them to build their own equity statement that advocates not only for the communities that they serve, but also for the prioritization of equity, right? Again, going back to the buy-in, which is such a real reality of our work. So their statement might look like, in order for us to serve the communities that we want to serve, we have to prioritize equity. We have to prioritize diversity and inclusion within our organization, which will require us to allocate resources, allocate budget, consult a professional, bring in diverse voices, form a community-led advisory board, right? Again, providing that person with the language to be able to advocate for the importance of doing the work. And so when we use these alignment statements, I'm telling you, we can use them in so many different areas of our work, not just, again, to align our mission, vision, or values, but to help us to advocate, to help us to push this work forward.
And they say that was great. Thank you very much.
One more question just popped up.
Yep. Do you want to go ahead and read it, Rob? Or?
Oh, go ahead.
Okay. From Melody, as we have seen, there have been some recent challenges to EDI and DEI initiatives. Do you have any tips on gaining support from decision makers to effectively advance these efforts?
I'm trying to think of something else other than saying the alignment statement. I think when you are in your position, depending on how you're approaching this work, it's so important to consider how you approach, right? I think you doing this as a collaborative effort is always going to be powerful. So I would start by drafting your own EDI your own statement on your own, right? Why is this important to you? Aligning it with your mission and your vision or your values, also the organizations, and you can have multiple statements, right? They can look very different. And then seeing how you can build allyship within that, how you can build a collective effort within your team or within your organization, and then bringing it to leadership. And I always recommend, though, considering things like safety, and consider things like how you're showing up, maybe identifying as someone from an equity deserving group. So we always want to consider how you show up. And so depending on that, you might want to even bring in mediation or a facilitator. But again, reach out so that I can also see how you show up in the work, and I can also support you in that.
You know, got some thumbs up and some applause there.
Awesome.
You know, one thing I think, Danielle, too, is that we take away from this is that to implement any kind of DEI initiatives, it has to be very deliberate. It can't be something that we think will happen by accident. Mm-hmm. And as you've laid out, there are certainly steps to take in order to achieve that goal. So thank you for that.
Absolutely. Yeah, it's intentional. And like I said, at that cycle at the end there, it doesn't stop. We are humans. We will continue to evolve. We will continue to change. What was okay 10 years ago, right, is not acceptable today. So the process, we have to commit to the process.
Right. Mm-hmm. Very good. Are there any other questions? Any other comments? We have time if people want to. Otherwise, we give you back some time in your day.
May I jump in with a question? Absolutely. Oh, did somebody else want to say something?
I don't see anything. Just your hand, Carol.
Okay. And so thank you, Danielle, for this information. It's fantastic. From an age-friendly community initiative perspective, and I'm just wondering, because I think the statement will be very helpful, and a lot of the information that you shared, and just wondering if I could just a little bit more, because part of it is engaging, like getting people to the table to engage with them. Do you have any tips for how, if they're not already in my organization, they're not already at my center, how do you get them and bring them in so that you can have the conversations?
Yes. Okay. There's so many. Okay. My brain is going 1,000 miles an hour right now. First, what I would say is without an equity approach, you're going to struggle with engagement. And that is always at the forefront of everyone's mind and working in communities. So like no one shows up, no one's engaged, no one really participates because we have a one-size-fits-all approach, because how we're doing things is not accessible or relevant. So then I would want to pull back to the needs, the values, and the barriers that I shared, right? That older adults defined themselves. They told us that cultural competency is important. Cultural competence and relevance is important. They also told us that representation is important. So we consider those things in, okay, if we're struggling with engagement, especially from specific communities, then we can look at are those specific communities represented in our staff, in our volunteers? Are they represented in our peer work? Are our programs and our services, are they culturally competent? Are they relevant? Are they interesting? The only way to be able to do this is when we have the community or the group specifically that you're interested in engaging define that themselves, to be able to bring them, shift the power, to be able to bring them to a table so that we can co-design what that relevant program and service looks like. Help get them or engage them, I should say, to create a space and a place where they actually want to engage and where they actually want to participate.
That's great.
Thank you.
I don't see any more questions, Danielle.
Awesome.
So before we say our big thank yous, Carol, do you want to bring up the next slide about the rest of our Diverse Seniors series? So as you should know by now, is that this is the first of 5 sessions that we have on diversity in the context of age-friendly communities. The next one is October 10th at 10, immigrant and refugee seniors. October 31st, when we have a panel with LGBTQ2S plus seniors. November 21st, Indigenous seniors. And December 12th, seniors living with disabilities. If you want more information and if you want to register for any specific sessions, visit corealberta.ca. Carol will also put a link to this session survey in the chat. And then please take a couple of minutes to provide us with some feedback on this session, and it helps us develop our future sessions as well. And a huge thank you to Danielle for her sharing her experience and expertise in this great discussion that she's led today. And Danielle, thank you very much. Appreciate it so much for what you brought to the table today, and for literally setting the table for the rest of our sessions.
Of course. Thank you so much. Take care, everyone. And again, don't hesitate to reach out.
All right. Thank you. Thanks, everyone.